Welcome to the Confidence Interval, an occasional podcast from the MRC Epidemiology Unit at the University of Cambridge, talking science, people and public health. We're using this podcast to explore the research happening at the unit, meet some of our researchers and ask questions about the wider implications of what we do. This episode features a recording of Improving Our Diets, More Freedom or More Control. This was a panel discussion of public health and policy experts that explored the role of evidence and ethics in helping policymakers decide how and when to intervene to improve the nation's diets. The event was organised by the Centre for Diet and Activity Research, CEDA, which is led by the MRC Epidemiology Unit, and the Bennett Institute for Public Policy. The discussion was chaired by Professor Mike Kenny from the Bennett Institute. So, fade in, Mike.
Panel discussion is the result of a partnership between two organisations here based at Cambridge. One is the Centre for Diet and Activity Research, CEDA, and the other is the Bennett Institute for Public Policy. CEDA is a partnership between the University of Cambridge, University of East Anglia and the MRC, and is committed to the goal of supporting effective interventions to change our diet and physical activity behaviours at a population level. The Bennett Institute, which is a more recent creation, was launched just a few months ago in April and aims to rethink public policy in the turbulent age in which we live, and is based in the School of Humanities and Social Sciences here in the university. I'm Mike Kenny. I am the director of the Bennett Institute and I will be chairing this panel discussion. So let me just talk you through how we're planning to spend the next hour, so everyone's clear on what we're going to try and do. I will give a brief introduction to some of the themes we want to cover shortly. After that, I'm going to ask each of our panelists to introduce themselves, so I won't waste time reading stuff out about them. I'll let them tell you who they are and just talk very briefly about their own research or professional experience in the area that we're talking about tonight. Then I'm going to facilitate a conversation between them, and we hope it generally will be a conversation.
At this point in proceedings, we ask the audience to vote using some interactive software, which allows them to answer a question via their smartphones.
So the first question: to improve the diet of the UK's population, should the state have more or less control over what people choose to eat? And I'm afraid it is a simple, it's a binary choice. More control, less control. So do you want to vote now?
82% voted for more control and 18% voted for less control.
Okay, I think everyone has pretty much voted now, so just take note of that result. We've got a pretty clear majority in this room anyway for more control, and we'll be discussing exactly what that might mean in this conversation. Just by way of introduction, you'll be aware that there is a growing focus in our media, in public policy, in politics, on the question of our dietary habits and some of the poor health outcomes to which they are linked. Barely a day goes by without another report from a public health body or from researchers, academics coming out, giving us increasingly depressing news, it seems. I don't know if any of you saw the BBC website today. A very interesting report that they've done based on ONS data about takeaways and the prevalence of takeaways in different parts of the country. I think they measure it per 100,000 of the population. What they find is, purely on those numbers, that the number of takeaways in most parts of the country is at its highest, I think, since 2010. And this is important because research tells us that people who are most exposed to takeaways are nearly twice as likely to be obese. So that's a pretty important finding. You will also find, connected with that story, Thomas Burgoyne, who we're going to be hearing from shortly, who's also quoted on that website. This is not just, though, a problem about takeaways. It's clearly not just a problem for the UK. Other societies in the West, and indeed, as we may touch on beyond, are also increasingly affected by and suffering in some ways from the dietary habits of their population. In terms of public health and what we do about this, how we respond to these sorts of challenges. I think we're all fairly familiar with the emphases on information and education. Let's give people more information about what it is we're eating, what the calorie content of foodstuffs is, how much sugar is in particular foodstuffs. And we're going to talk about those kind of approaches, but there seems to be a growing body of evidence to suggest that they are insufficient, that they don't appear to make enough of a difference. And what we're going to cover here is whether there are other kinds of approaches, other levers we should be pulling, other ideas about changing the environments in which we make our choices about what we buy, what we eat, and whether indeed we should be thinking of even more what we might call directive or coercive measures taken by the state, which might move us into questions about fiscal measures, taxation, regulation. We'll all be familiar with the sugary drinks levy that has been introduced. We want to cover those approaches and hear about some of the evidence for how they work or don't work. We're also interested in the ethical aspects of this. Whose responsibility is it for our unhealthy eating habits? Is it ours as individual citizens? Or is it the food industry, who maybe profit in some ways from our weaknesses? Or is it the state that ought to step up and act on behalf of the public good and maybe constrain some of the choices we might make? Those are the issues we want to get into, and of course this raises some interesting and difficult questions about whether this is another area of our life where we're letting the state actually take too much control. And then one theme I want us to get to, if we can, is about politics. Why do politicians find it so hard to take these issues on, despite the overwhelming body of evidence about the costs of unhealthy lives, and about the connection between unhealthy lives and health inequalities, which is something we'll be covering? How might we try to push towards a different kind of political conversation? I'll be interested to see what our speakers think on those issues. So, let's start by meeting our panel. I'm going to go from right to left here. Professor Mike Kelly is sitting here. Would you like to introduce yourself and your research?
Yes, well, good evening, everybody. My name is Mike Kelly. I'm presently a senior visiting fellow, which means I'm retired in the Department of Public Health and Primary Care here in Cambridge. Before I retired, I was the Director of Public Health at NICE, and I had responsibility for all the guidelines which NICE produced relating to prevention of non-communicable disease, which include all the stuff on obesity, alcohol, physical activity, and a whole range of other things too. The high point of my career, I think, was being called Super Nanny, or Nanny in Chief by the Daily Mail. I was always a target for the Daily Mail. They didn't like what we did. They found NICE's approach to public health, but also to drug appraisal, all sorts of things, not to their taste at all. And so I spent a good deal of time, just being in the Daily Mail. I also, every time we produced a new guideline, it was my job to front the television and media, and I used to do 3 rounds with John Humphreys on the Today programme fairly regularly. So coming to Cambridge and doing some research on health inequalities and the prevention of non-communicable disease is a rather quieter life than the one I used to lead. But because, of course, of my role as a super nanny and the role here of the state, I've been inveigled to come along and share some of that with you.
Thank you. So that's Mike, our very own super nanny. Dr. Jean Adams.
Okay, hello, my name is Jean Adams. I work in CEDAR, the Centre for Diet and Activity Research. So I'm interested in understanding what sort of policy can help everybody to eat better. I started out immediately after school training to be a doctor, but very early in my clinical training I began to get really frustrated by the number of people I saw sick in hospital who were there for reasons that I felt could have been avoided. So this kind of came to a head illustrated in one 8-week rotation that I spent on a general medical ward, where there was one gentleman who was admitted 3 times during that 8-week period with exacerbations of a lung disease due to smoking. So that encouraged me to move from treatment to prevention, and the biggest preventable causes of illness in this country are cigarette smoking, poor diet, physical inactivity, and alcohol use. And these are things that I think you could put down to personal choice. And I did start early in my PhD thinking that the solution was somewhere in psychology, and exploring that to understand why people were making what I thought were bad decisions, and how I could help to find ways to make them make better decisions. But the more I started to think about it, the more it became clear to me that nobody ever really makes kind of cold, clear, rational decisions about really anything. Every decision we make is influenced by what's easy to do, what our friends and family do, how much money we have. And a whole host really of other contextual factors are influencing everything we do, really. So I guess it's important to me that lots of people express an aspiration to eat better, to feed their kids better. But in this country we don't do very well at diet. And in fact, poor diet accounts for as much death and illness in this country as tobacco smoking. And what people eat is also very clearly socially patterned. So people with more education, people who earn more, people with higher status occupations all tend to eat better. So the sorts of contextual things that people at CEDAR have found to be associated with diet are things like what foods are advertised on TV, what food stores people have access to, and Tom will talk about takeaways, what foods in the shops that people go to and how much that food costs. And these things are all socially patterned as well. So our current work is trying to address these wider influences on diet. And we're trying to explore what sorts of environments can help everybody to eat better. And the sorts of things we're currently exploring are things like changing price through the soda tax that people have mentioned, government incentives to change what's in processed food, to reduce the sugar, reduce the calories in processed food, regulations on restricting advertising to children, and removing junk food from supermarket checkouts. And our hypothesis is that if you can create an environment in which it's easier to eat well, more people will find it easier to eat well and will do that.
Thank you very much. Tom Burgoyne.
Good evening, everyone. So I'm Tom Burgoyne. I'm a health geographer based again at the Centre for Diet and Activity Research. And I'm interested in neighbourhood food environments, so how the distribution of food outlets in our towns and cities and where we live and work are related to the types of foods that we eat, ultimately to our waistline and downstream to our health. More specifically, I'm really interested in the role of fast food access. It's a really interesting behaviour. I think we're probably all eating too much fast food. Some of us are eating a lot more fast food than others. We know that it's not necessarily that healthy. We know that over time, consumption of fast food is linked to weight gain. And basically my research focuses to a large part on whether access to fast food in our neighbourhoods and our towns and cities is cueing that behaviour. This is something that I've been studying at CEDAR for the last 5 or 6 years. And in large samples of people across this region and in London and other parts of the country, what we're beginning to see is that people who have higher numbers of fast food outlets around these important kind of daily realms of life, they're generally tending to eat more fast food, be heavier, and in one study in this region, those most exposed to fast food were nearly twice as likely to be obese. As Mike said, the BBC picked that up today in one of their reports. What I like about this work is how applied it is and how some of the things that we can learn from that research can directly influence public policy and kind of help us get to finding a solution to the kind of epidemic of obesity levels in this country and elsewhere. So neighbourhoods, in terms of their design, are not as they are by accident. They're very clearly thought out, and it's not beyond the realms of local authorities and planners in local authorities in this country and elsewhere to shape those neighbourhoods in order to help us make healthier choices and to make healthy choices easier choices. So a really concrete example of that is restriction of fast food outlets. So in areas where levels of obesity are high, or where there are already a lot of fast food outlets, nearly 50% of local authorities at the moment have got some sort of regulation that says we want no more fast food in those areas. And a third of all local authorities, so that's nearly 100 of the 325 in this country, are using health as a justification for those restrictions. So that's the kind of intervention that I'm interested in, and that's how it's informed by my research. I guess the last thing to say is I guess that sort of intervention is increasingly acceptable, it seems, among policymakers. Businesses don't find it such an acceptable intervention, and I don't think the public generally get a voice. So I'm excited to hear what you think when we get to the Q&A.
Just to add on to that, I mean, what is striking about today's report, if those figures are right, is that despite the growing number of local authorities that are trying to regulate and restrict takeaways, actually it appears that that is having very little effect at the sort of aggregate level. So that's something we can talk about. Which policy levers actually work, and are they being enthusiastically used? Our final speaker is Professor Jyoti Prabhu.
Thanks, Mike. Good evening, everyone. It's a great pleasure to be here. I'm at the Cambridge Judge Business School, where I teach marketing and I research innovation. So I'm very interested in how companies of various sorts develop new products and services to engage with their customers. I'm particularly interested in what's being called frugal innovation, namely how companies can do more and better with less, both in developing or emerging markets where resource constraints encourage them to be frugal, but equally in the West, where increasingly small groups of people, including some of our own students, can take advantage of ubiquitous tools now to do things that only large companies or the government could do a few years ago. And in fact, combined with that, this empowerment, we find that there are increasing numbers of what we might call social businesses or social entrepreneurs, which are entrepreneurs who want to solve social problems, such as the problem of unhealthy eating and poor diets, using some of the tools of business, sometimes to make a profit, but in other cases to actually plow those profits back into achieving their social objectives.
Thank you very much, Jaideep, and thank you all. So let's start with maybe picking up the final point there that Jaideep touched on, innovation, and also particularly in the era of information. There is an awful lot of information out there, some of it provided by public health bodies, the academics, but just, we live in an era where information is readily available. Does it make a difference in terms of our choices in relation to, particularly to eating and unhealthy eating? Jaideep, what's your sense of this? Do you see, there's a great proliferation of apps now, Change for Life and others that people may know about. Do you see this as an opportunity to empower individuals in relation to this area?
So, information is obviously very important, but it's how that information is communicated to people and what the agency that's doing it to engage consumers, how that agency is actually using that information. So the issue of agency is very important. If you look at consumers, and what affects their decisions and what affects their diets, in many cases they have fallen under the sway of businesses that have used information in a very clever way to engage them over a period of time. And that information may be contained in the product itself, in the brand, in the packaging, but also in their messages, their promotional messages, in their campaigns, but also in the price. And they can use these tools to tailor their solutions to different types of consumers so that that message means something specific to a particular type of consumer. And this is the way in which, say, a Coca-Cola or a McDonald's over a period of time is able to capture a large part of the market. So I'm very interested in those tools, and now increasingly the government can use those tools, and we see that. So I brought along with me what you mentioned, Change for Life. This is something that was handed out to my son in the state school that he goes to here in Cambridge. So Change for Life, as some people know, is a Public Health England program where they seem to be adopting some of these very tools. So for instance, this has some information in it, but it also tells you about an app which you can download. So my kids downloaded this app. And it's a very engaging app because you can then scan using the camera in your smartphone the barcode on products. And the whole traffic light thing comes up in a very vivid way on your tablet. And you can see how much salt there is in that product, how much sugar there is in the product, how much saturated fat there is. And then it does this in a very vivid way because it shows you the number of sugar cubes that went into making that product. And what it does is not just provide the information, but engages people in their own behavior in a very interactive and friendly and perhaps attractive way. And I think now you see smaller companies, startups, these social enterprises I was talking about, using the same approaches, apps to get through directly to people and engage them in their own behaviors, and then often use that data which they collect, a bit like Amazon does. Amazon is able to collect data on our behavior and then use AI to give us recommendations. You have food apps that are doing this. So there's something called Mindful Chef, which you may have heard of, which is actually a box recipe meals company. So you go on their website, they have different meals that you can choose from, and then they deliver a box at the beginning of the week with all the ingredients. So this helps you to actually prepare your own meals in a more friendly way. And of course, they use that information to help you make better choices over time.
Okay, so I'm going to come to Mike Kelly for his views on this, having seen the development of these kind of technologies and apps. Just before I do, I just want to ask the audience, and here we won't use the technology, you may be pleased to know. I'm just curious, how many of you have used an app like Change for Life? There are others, aren't there? One You, Eat Well. Have any of you actually engaged with these apps, or for your kids, or do any of you use them? Show of hands if you're feeling brave. So I would say that's a small portion of the audience, maybe a fifth. Looks like a fifth. Okay, so that's interesting. So in this audience in Cambridge, that doesn't appear to have swept the board, but some people are clearly engaging. Mike, what are your thoughts?
You're absolutely right. The degree of sophistication of marketing of products of all kinds is fantastically clever. The way that the government goes about it and the way public health England go about it is incredibly naive and bad. The ability of Public Health England to put across an information campaign is somewhere in the dark ages compared to what, say, Nestle are doing, Sainsbury's are doing, and Tesco's are doing. It's just not a level playing field in terms of these sorts of things. You might argue it's perfectly possible for government to be as sophisticated, but of course government did once upon a time have a very, very sophisticated communications and advertising agency called the Health Education Authority. And the decision was taken about 2000 to close it down and give the job to the Department of Health. Now, can you imagine getting rid of Saatchi and Saatchi as your basic foot soldiers to do your advertising and replacing them with a bunch of civil servants? Well, that's what the Department of Health did in 2000. And not surprisingly, therefore, information campaigns have an appallingly poor record of bringing about behaviour change of the type that is required here. The last major successful information campaign was probably one that those of us who are over the age of about 50 will remember very well, which was Don't Die of Ignorance, the HIV/AIDS campaign 25 years ago or more. And that was run by Saatchi and Saatchi for the Health Education Authority. It wasn't run by civil servants. So first of all, the sophistication is there, but government chooses not to use it. Second, of course, the food industry love information campaigns because it gets them off the hook. If it's down to the person, you and me, to change the way we eat, the way we drink and so on, it becomes our responsibility. The guys that are making a profit out of selling you this stuff don't have to do anything. And that, of course, is precisely why they're so supportive of these kinds of education campaigns, information campaigns. Now, information is important. It's part of any decision to make a change in one's behaviour, but of course, on its own, it doesn't work. And that's something, of course, the industry knows very, very well, that I'm afraid Public Health England seem delightfully naive about. And Change for Life, I have to say, is one of these, the evidence suggesting that it is doing any good at all, I've not seen. Perhaps other people in the room have, but I'm afraid it's entirely lacking. So I'm not a great fan. When I worked at NICE, we weren't great fans of information campaigns as a way of changing things, because the evidence just isn't good enough to suggest it would work. And therefore other tactics, which we'll come on to, I'm sure, in a moment, are required.
Thank you. Let me just follow that up with Tom and then Jean. Tom, I was very struck in the report, the BBC report today. There was an organisation I'd never heard of called the British Takeaways Council. Is that right, the BTC? Their response to this data that came out was to say, well, really, what ought to happen is that takeaways ought to be publicising the calorific content of the different meals, the different food that they are selling. And I thought this was a really interesting example of a bigger dilemma here, because beyond whether the information campaign is done well or not, does providing information work at the level of psychology. Do we actually respond to that kind of signal, to that sort of information provision, or do we wander into takeaways, maybe after we've had a very fun night out and in a certain kind of social situation, and actually make choices because we are in certain kinds of settings? So let's just start with you, Tom, because you're all over the takeaway story. What is your thought about that? I mean, is that a credible response from industry in that particular situation?
Yeah, let's think about calorie labelling on menus in fast food places, because actually that's something that's on the cards as part of the government's second iteration of the Childhood Obesity Plan. Like, on the face of it, it seems to make sense, doesn't it? We provide information, we tell people how many calories are in everything in the menu, so they're empowered to make healthier choices and cut down the calories in the kind of choices that they make in those places. Unfortunately, I don't even know if it gets to the level of psychology. Roughly only a third of people, it's been shown in studies, actually notice the calories on the menus in these places. I think McDonald's has been posting calories on their menus in this country for at least the last few years. And I don't go into McDonald's that often, I have to say. But when I do, I've never noticed that they promise the calories on their menu. I think they do them in very small font and not so prominently. So there's very little evidence that people actually notice those. And then when you do notice them, you need to know what to do with that information. So you need to have the kind of the cognitive ability, if you like, to think, okay, so I ate this many calories at lunch, I'm going to have this many calories for dinner, my maximum amount of calories to consume today is this, because there is a lot of decision making that needs to go on there, and you need to really engage with that intervention and kind of act on the information that you're presented with in order essentially for it to be successful. So there's very little evidence that people notice these things, and very little evidence that calorie labelling in particular works, which again might be part of the reason why the British Takeaway Association or Council is in favour.
It's great to discover that there is a British Takeaways Council, I have to say. Jean, can I just come to you? I mean, so there's Tom's reporting evidence really about the limited sort of efficacy of that kind of labelling. But just to sort of dig beneath that a bit, I mean, I was struck by something you said about you got very curious about the psychology, the kind of human behaviour around food, and we know the brain is a complex organ, and we know that in many ways we are more likely to respond to signals and cues, even if we're not terribly aware of them, than we are really to make free choices. What's your thinking about that? I mean, do you think we need to kind of get real about the kind of things that make us make choices when we're in a takeaway or when we're in a supermarket?
Yes, I think probably we do. We need to think about decision making not just as the rational decision making that I was talking about earlier, but also that the kind of automatic things that make us make particular behavioural choices that perhaps aren't going through the cognitive, so are encouraging us to behave in particular ways without necessarily thinking about it. And that's the sorts of tricks that supermarkets are known to play on us, like things like pumping the smell from the bakery into the car park, so that we're all primed to be hungry as we walk into the supermarket, and placing the brightly coloured items at child's eye view, so that those encourage kids to grab them off the shelves. I guess I wanted to pick up on one of Tom's points about menu labelling. So there isn't much evidence that menu labelling helps people to make different choices. But there is some evidence that it works more in more affluent consumers. So people who are particularly, conscious about what they're eating may particularly respond to labelling. And that obviously is going to widen social inequalities in diet. But the other thing that menu labelling might do is encourage the manufacturers, the takeaway owners, or McDonald's to reformulate what they're serving, to serve different things so that they're not publicly shamed in their own restaurants about how unhealthy the food they're serving is. And there is some evidence from the States, and one of my master's students replicated it in the UK this summer, suggesting that if people do declare how many calories are in their meals, they're serving meals with fewer calories in them. So I think we do need to think sometimes about how interventions might work at both the conscious and the non-conscious level, and that might be from menu labelling.
So one of the approaches that have become much more familiar and I guess a bit more legitimate in the public health field is the idea of changing the environment in which we make choices. Some of you will have heard the term nudge. So whether we ought to be nudged to make better choices, whether we like them or not. So this seems to me is a kind of different sort of intervention to this is trying to guide choice rather than just ban something or restrict choice. So I just want to put the question of nudging to the panel, and it's been something that's been, I know researchers here at Cambridge are looking at in terms of whether this makes a difference in terms of what we buy in a supermarket, or even whether if you vary the size of wine glasses, whether actually you end up drinking less wine over the course of an evening in a wine bar. So nudging. Let me just start with Eugene, just picking up on that final point. Is your sense that nudging works? I mean, instead of having the sweets at my kids' eyeline, if we put broccoli, or if we put different kinds of choices, might that make a difference? But secondly, do you think that's publicly acceptable?
Well, so firstly, there's some evidence that some sorts of nudges work. So certainly there's some on portion size. If you serve people less or you provide smaller packages or smaller crockery, then they tend to eat less. Nudging is a slightly diffuse term that people use to mean lots of different things. So there's less evidence for some other sorts of nudges. But it certainly seems to have potential, some things. I suspect that sort of thing is more publicly acceptable than many of the other things we might talk about today, because it doesn't, it doesn't change what's available to you. If you put the broccoli here rather than here, there's still broccoli, and there's still, let's say, Coke. There's still Coke and broccoli on the shelf, but you're being given a cue to choose the broccoli rather than the Coke. I guess I would like to know whether people feel that that's manipulative.
So that's one of the big ethical questions here, whether starting to use these nudging techniques, changing environments, are we guiding choice or are we manipulating people? And as Jean said, there appears to be some evidence that these kind of methods can work. Mike, can I just come back to you on this, because you'll have seen these kind of approaches come through. And this is a different kind of intervention altogether to raising a levy on sugary drinks. What's your sense of the potential for behaviour change by addressing these questions of the environment?
Okay, well, I think the jury's out. First of all, the whole idea of nudge was popularised by Thayer and Sunstein, two American behavioural economists. It's been grossly overhyped, particularly by a unit that was set up called colloquially known as the Nudge Unit, Behavioural Insights team, initially in Downing Street, which has produced, I think, 3 papers in the 10 or more years it's been running that have been peer-reviewed and got into the scientific literature. The rest of it is a kind of form of hocus-pocus stuff, which is based on sound psychology, one has to say, because the distinction between, that Jean mentioned, the automatic response and the calculated response, that's real enough. A nudge focuses on the automatic responses. But as a general principle, it sounds great. It's been very popular with politicians in this country. I believe David Cameron made Nudge, the Thayer and Sunstein book, compulsory reading for all prospective Conservative MPs before the 2010 election, I presume. Very popular because it sounds very easy, but in point of fact, if you look at the research that's been done here in Cambridge by Teresa Marteau's group in the Behavioural Health Research Unit, who are carefully deconstructing the more accurate term is the choice architecture, which influences people's behaviour, and learning about the different elements in it. The evidence base is very thin. Some of it, as Jean rightly says, we do know a bit about some of it, but the evidence base across the board is pretty thin. And until we've got more evidence, the notion of committing wholesale to this as a form of behaviour change is at the very least unwise. But it's really great because it sounds so easy and so simple. It's what Daniel Kahneman calls a form of fast thinking. You get to a solution to a complex problem ever so quickly. But actually, simple solutions to complex problems, hey, guess what? They tend not to work. And that's what's happened, I think, on all of this. The nudge unit's made a fortune. They've been great high profile, but I'm afraid if you're taking an evidence-based approach and a scientific approach, there's not much in the cupboard at all.
Okay, thanks. I want to get to that question about time horizons in a moment, about how, what's a realistic time horizon for dealing with some of these issues. Just before we do, Jyoti, coming back to you, I mean, I think the points Jean's making here about supermarkets and their, it seems supermarkets and other corporate players appear to have a pretty good grip on, pretty good understanding of what motivates us as consumers, what triggers our desire to spend in certain ways, what kind of cues we respond to. I mean, do you, looking at this debate, as someone who knows a lot about business and marketing, I mean, do you echo Mike's point that actually we ought to be thinking much harder on the kind of public health side about a more sophisticated set of interventions in terms of our psychology and our motivations?
Yeah, and I think the time frame issue that you're going to come to is an important part of that, because if you think about brands like Coca-Cola or McDonald's, they didn't achieve their market share overnight. They did it over a long period of time by using many of these tools of behavioral psychology, as it turns out. So you could think of Coca-Cola's dominance of its space as a result of innumerable nudges over a long period of time, with a single-minded focus on getting people to essentially consume and want to consume colored water with a lot of sugar. But it is actually applying, whether they're aware of it or not, all these tools of behavioral psychology and behavioral economics. So as I said earlier, they will use all the tools at their disposal, starting with the ingredients in the product, the packaging, the brand, where it's available, including where in the store it's located, the shelf space, so usually eye level so you can see it. Price is a very powerful tool that they use, and they use nudging as well by giving you discounts. It gives you a thrill just to have got something on a discount. And then of course their advertising campaigns over a period of time. So businesses are incredibly savvy, but even they don't achieve this overnight. It takes a long period. So if the nudge approach is to work in the opposite direction, to get us to do something healthy, where sometimes doing that is against our evolutionary instincts, you would need to do this over a long period of time in a very focused, concerted way. And the problem sometimes with governments is that they're distracted, other things come along, they don't necessarily have that single-minded focus over a long period of time. It's not that companies do, actually companies do also have distractions, and they're also often thinking short-term, but they have to combine the short-term with the long-term as well. So they're trying to keep shareholders happy, for instance, and that's often a short-term thing. But they're also having to do this over a longer period of time. So that also makes them want to change. So if you look at McDonald's, it's sort of cottoned on to the fact that, society is changing for various reasons. People are worried a bit about their health and wanting to eat better. They're also worried about regulators and regulation turning on them. So some businesses will start to shift in that direction. So you can see McDonald's trying to make their meals, not overnight, healthier, but gradually. And again, it's another set of nudges because they realize they're going to have to convince people to start eating a little bit more healthy. So they'll gradually nudge them, and they'll do that over a period of time.
Okay, Tom, is there, in terms of your own research, thinking about high streets and what's available to people in terms of food choices, is there a positive story at all to tell about business growth in relation to healthier eating? I mean, we've talked here about the powers of local authorities to license takeaways, but presumably, for this to work, for us to really actually change the sort of local geography of a place in terms of what food's available, wouldn't we want there to be new kinds of innovating businesses coming in and selling healthier options that actually people think, well, I'd rather go to that? Is there any evidence of that?
Whether there's evidence of that is a very good question. I think there's definitely room for innovation on the high street, and it seems to be the case that in a lot of areas, if we deny a fast food outlet opening in this location, and there is a real kind of perceived risk to that business or business shop unit just remaining empty and not being profitable and not contributing to the kind of local area in terms of jobs and other aspects of the economic side of things. I think that the high street is able to kind of come up with new things to do with that unit, and that fast food is not the only thing that can be done with that space, and that given time, that there will be that innovation, and I'm sure that you could speak about kind of innovation on the high street more so than I. But I mean, at the moment we're in a situation where a lot of our high streets are a third to a half fast food. So this is really about choice, and if we want consumers to make healthy choices and to execute their free will, and I think we'll probably get on to free will, we've got to provide them with a set of choices. And fast food can be part of that choice, but I think 50% of fast food is starting to encourage unhealthy behaviours, and that's certainly coming out in the research.
Yeah, so just picking up from that, let's get into, you teed up the kind of, I suppose, the major ethical dilemma that flows from thinking about these sorts of questions. If we think there is a real problem here, and some people talk about a crisis in terms of public health, and I want to come to that notion in a moment, but if we think there is a significant worsening set of problems here around these sorts of behaviours, who is ultimately responsible for them? So just to put this back to you, the audience, we want you to answer pretty much exactly that question. Can you vote now? Again, you've got to pick one answer. Is it individual? Who ultimately is most responsible? I'm sure you'll all think, well, there's degrees of responsibility here. But who, if you were to really pin the blame, would you vote for?
42.5% voted for individuals themselves. The same percentage voted for the food industry, and the remaining 15% voted for government.
So let me put the same question effectively to our panel and to offer your thoughts on that particular response. Who would like to go first? Mike, thoughts on that?
Yeah, I think to answer this question, you need to take an historical perspective, actually. Public health has been around a long time and has wrestled with the question of state responsibility versus individual responsibility versus the responsibility of commercial and other vested interests. In the 19th century, one of the great scourges, the crisis wasn't obesity, it was cholera. Periodic epidemics every 20 years or so, killing many, many people. In the Soho outbreak in the 1850s, where Dr. John Snow was to find fame, apocryphally actually, for removing the hand of the Broad Street pump because he suspected that cholera was waterborne. About a month before that happened, the Times ran an editorial proclaiming, the thunderer thundered, we would rather take our chance with cholera than be bullied into health by Chadwick and his medical advisor, Chadwick being the great public health reformer of the 19th century. So the notion of the state bullying people into this, that's been around a long time. And of course, vested interests all the way through the 19th century tried to stop the building of the sewers and the provision of clean water. It took in all nearly 100 years to get to the point from the first suspicion that cholera was a waterborne infection to the things which led to the cure. And even then it was by accident, because Bazalgette, who built the sewers, believed that cholera was caused by bad air. He didn't think it was in the water at all, even though he built the sewers. With smoking, Donald Hill's first paper indicating the connection between exposure to cigarette smoke and lung cancer appeared in 1950. We got a smoking ban nearly 57 years later. The evidence was clear by 1962 that smoking was a major threat to health, but you can imagine Macmillan's cabinet as they received the information from Royal College of Physicians, 1962, where 2/3 at least of the men around the table would have been smokers. But the kinds of things that we've come to accept as the way of tackling the tobacco epidemic was simply just inconceivable then, and it's taken 50 odd years of various, and this is the point, multi-layered, multiplex campaigns, from education through to legislation, through to advertising, through to price, through changes in public opinion about smoking. You know, when I went to university, lecture theatres like this had ashtrays in them, and we used to smoke. The lecturers used to smoke. Now, can you imagine if one of us lit up a fag? You know, this would be considered bad manners at the very least. But bear in mind that time scale. When you have a public health problem like the obesity epidemic, we're talking about turning around a supertanker. It's not something that an easy solution today is going to work with. We're in for a long, long haul. I hope it's not another 57 years. But the appetite politically for taking it on, I just don't think is there. The food industry is very powerful, and they do everything they can to say it's all about individual choice. And obviously, quite a number of people in the room believe that to be the case. There's individual choice involved, of course, but that's not all. And we won't change the situation if we rely only and absolutely on individuals to do that.
Can I just follow that up? I mean, if, that's a very well-made point, that any, and the historical analogies are very interesting to think about, any major shift in terms of state-level response to other crises of public health have required institutional change, be it legislation or be it different kinds of social provision, but they've also required culture change.
Absolutely.
They've required shifts in attitudes. As you say, these things, despite we're playing around with these questions, but actually, obviously, it's never just about one thing. I just wonder, with this particular crisis, to use that overused term, particularly around obesity, is your sense that we are really looking at, at least 20, 30 years? I mean, that kind of time frame before we can really get to grips with it.
At least, but we're also, and the politicians consistently, and Public Health England, consistently try and solve the wrong problem. Because they're looking at the causes of obesity, which are that people eat too much, too many calories and all that kind of thing, rather than looking at the kinds of things which would allow people to do things differently. Tobacco control has only been successful not because we know that exposure to cigarette smoke causes carcinoma of the lung. That's not what changed things. It was when tobacco control got wired into understanding addiction, when it started to understand the economics of the elasticity of the price of tobacco products, when it began to understand how people responded to advertising. So it wasn't evidence from biomedicine about carcinoma of the lung that allowed the changes to happen. It was a whole lot of other evidence from other disciplines that in the end led to the kinds of successes we've had with tobacco. And unless and until on obesity we stop worrying about diet and turn our attention instead to the psychology of eating. I was very struck earlier on, we talked about going into it. The last thing you want to do when you're sitting down for a meal is looking at the calories in it. You're there to enjoy some food, not to do a calculation in your head about the number of calories you're eating. You know, you've got to understand what eating is all about. It's a social practice that people enjoy. Unless and until you take that on board, you're trying to solve the wrong problem. But governments love to solve the wrong problem because they think it's easy.
Is there anyone here who does look at the calorie content of their meals before they even take one? Oh, one person at the back. Yeah, can I just turn to you, Jody? Is there, in terms of this, I think we're probably all broadly on board with what Mike's saying, that this is complicated stuff, and this is going to involve different kinds of actors for different parts of our society, and perhaps a new consensus being forged over time. What about the business community? What about, which is often demonised in terms of the food industry? Does it have a role to play, particularly around, you talked about some of the mechanisms of pricing, but also in terms of more socially responsible behaviour? Do you think there is a business model out there that they could use?
Yeah, I certainly think that, if I were to choose, I'd probably choose between the food industry and government, because they have the most power in a way to make change happen over a longer period of time and shape individual behavior. Individuals are more or less individually powerless. Together they're powerful, individually they're powerless. A business obviously has a lot of power and they will pursue their agenda, but different businesses pursue different agendas depending on the nature of ownership of the business, depending on the size of the business, depending on its original business model, how it's making its profits, depending on whether it's owned by shareholders, or in some cases, it's owned by the state. In many parts of the world, business is owned by the state. Increasingly, you have this notion of a social business where they have a sense of responsibility actually legally built into them, a B Corp as it's called in the US. So, there are businesses and businesses. But even if you look at the sort of prototypical shareholder-owned, profit-making, profit-maximizing business, even there are differences in culture. I think Mike was talking earlier about how in his experience, you could have, say, a Unilever, you could have a McDonald's, and you could have a Kellogg's, was it you were saying? And each of them, very similar in terms of their ownership structure, their profit-driven, trying to maximize shareholder returns, have very different cultures, depending partly on the leadership, partly on their heritage sometimes, what they were originally set up to do. So if you take a Unilever, their CEO, Paul Polman, in 2009 when he took over, sort of one of his first things was to introduce this notion of the sustainable living plan, which is a very bold, ambitious plan, a challenge to the entire company, that in 10 years they were going to completely change their business model and make it a far more environmentally responsible but also socially responsible business. And he also made some structural changes, for instance, in how they did the reporting to the stock market, and also their ownership structure. So he actually moved the ownership away from more short-term hedge fund owners to more long-term pension fund owners, because he realized that he needed that kind of time frame, and the company needed that time frame to make these systemic changes. Systemic changes in terms of how they sourced material for their food, how they worked with farmers, and then of course how they package the food and all this kind of stuff, also the ingredients in the food. Whereas other businesses, maybe more short-termist, may try and oppose these sort of trends in society towards healthy eating. They might invest their money in lobbying governments to either drop regulation that makes it harder for them, and you see examples of this in front of your eyes across sectors. So business is a very complex field, and I think increasingly we also have new forms of business that are also thinking about more responsible forms of business and are using the tools of technology sometimes to be able to deliver better outcomes, not only for themselves but also for society.
Thank you. So I think it's very important to have this more nuanced sort of approach really to the business sector. Jean, I got the impression from your self-description at the beginning that you would not be voting for individuals themselves. Is that right? And why is that? And where would you apportion responsibility?
I guess I wouldn't put the blame on or the responsibility on individuals themselves because of the many influences in their surroundings that are driving their behaviour choices. So then the question is, who is responsible for that? And I'm struck by the focus on the food industry but not governments, because my, albeit quite naive, understanding of food industry and business is that their primary driver is to make money, and that they're competing with each other to do that and to sell us food, and that whilst kind of healthy eating can be a marketing way to sell a different type of food, really the issue is selling the food to us and making money, and that to really encourage them to change their behaviour, you probably need government regulation to mean that they can compete in a different space from that they're competing in at the moment. And I guess I'd be interested in whether that is just ridiculously naive or. So I kind of feel that the chain of responsibility goes this way, and that if you want to change these guys, you have to change the government, or government has to act.
And just finally in this section, Tom, can I put the timeline question to you there? I mean, my sense is from your research, you are looking at some pretty depressing sort of stats in many ways, or certainly it looks as if there's some pretty marked patterns of health inequality, and that's particularly playing out around changes in the high streets and so on, the kind of food eating habits we have in our localities. Is your sense then that actually this is going to take, to turn this around, I think you called it the tanker, is this turning a tanker around here? Or are there maybe also quicker wins are there things that we could do right now that the state might be able to do that might make a difference in the shorter term?
So the planning system in particular, as it's set out at the moment, is partly being used to address public health by denying planning permission to new takeaway food outlets. It's not designed to work when one takeaway food outlet changes to another takeaway food outlet. There's no point of intervention there, but if it's a cafe and it's changing to a takeaway food outlet, that planning permission can be denied. And if we want to make faster change in what the food environment looks like, we will have to think about other ways that we can make more drastic changes. Because if we're just looking for places to go out of business, just capping current levels and waiting for levels to drop over time, that is going to be, we are going to be in for the long haul there. We've seen, massive numbers, year-on-year growth over the last 20 years in this country. We've never had easier access to fast food. We've never had more imbalanced neighbourhoods, and they will take an awful lot of time to reverse. And if I were to put an answer to this question, I mean, it's really tricky, it's hard, it's a difficult question to put where you would go. I mean, just in terms of the government, as Jody said, the government are uniquely positioned to pull some of the levers that could be used to address this kind of massive obesity problem. They're the only ones that can do a lot about some of these things. And I understand one of the roles of a responsible government is to look after the healthcare of its people. And of course, one of the ways that they do that is they fund the NHS and they treat people who are ill. But another way that the government can do that is to help people lead healthier lives and not become ill in the first place. So I think that's where the government is uniquely positioned in some respect, be it through taxes or planning or otherwise, to actually make a difference.
Great. So we've reached 7 o'clock. So there may be one or two people who need to slip out at this point. But we have a few minutes for you to actually put some questions and thoughts to our panel. So the final act of this event is to get you to all vote once more, if you don't mind, on the proposition of the question we put to you before you heard the discussion, the debate. And if those of you who've got Wi-Fi and have the app in front of you could just vote again. The researchers here are just very curious to know whether you are in any sense affected by the conversation you've heard.
This time, 87.5% voted for more control and 12.5% voted for less control.
It looks as if more people, maybe slightly more people now are on the side of more control, perhaps, following the discussion, or maybe the libertarians just left. Who knows? I do hear perhaps in the discussion. So can I just finish by asking you all to thank our panelists because they've been incredibly generous and interesting.